Hello, everyone, and welcome back to the Women's Health and Fertility Podcast. I'm Dr. Tina Yang, and if you are anywhere on your fertility journey, today's episode is a must listen because we are joined by a medical leader who has spent more than 3 decades helping families bring their dreams to life. Dr. Robert E. Anderson is a double board certified powerhouse in obstetrics, gynecology, and reproductive endocrinology. As the founder of the Southern California Center for Reproductive Medicine and the Institute for Reproductive Sciences, he pioneered many of the advanced IVF techniques we consider standard today, from assisted hatching to embryo transfers. But what makes Dr. Anderson truly exceptional is his dedication to evolving patient care, including a deep 20-year history of integrating acupuncture into his IVF protocols to optimize clinical results and support patient well-being. He is an international speaker, a stem cell research collaborator, and annually named a Castle Connolly Top Doctor. We are so honored to have his brilliant mind and compassionate heart on the podcast today. Well, welcome, Dr. Anderson, to the Women's Health and Fertility Podcast. Thank you so much for taking the time to join me today. I know how busy your schedule is, especially because we've been working together for, gosh, probably 15 years, maybe
Yeah,
something
something
like
like
that.
that.
Yeah. Well, let's just jump right in. First, I just wanted to ask you, what inspired you to become an OBGYN?
Well, it's kind of a long story, but I'm going to give you this whole story anyway. When I went into medicine initially, I thought I wanted to be a surgeon of some sort because that whole idea of surgery was really fascinating to me. So I went to medical school with that in mind. When I did the surgical rotations and I saw what the surgeons had to go through during a residency, I kind of changed my mind because it was just a little bit too much every other night on call and up
Mhm.
all night when you're on call. Back in those days, they didn't have the protections for the residents that they have now. So it was really pretty difficult. I also had a list of specialties that I thought I would never want to do before I went in, and OBGYN was one of them. Then I did my OBGYN um, months, and I was shocked because I really liked it. And at the same time, there's also a lot of surgery in OBGYN.
Right.
So I kind of thought, well, this really satisfies that need that I had. And it's also, your patients aren't sick. You're doing something that's brings happiness and joy to your patients when you deliver the babies. And
Yeah.
everything was just really fell into place. So I decided to go that direction.
Well,
Um,
that sounds like it would. I'm sorry, go ahead.
yeah, and then when I got into my OBGYN residency, that's when in vitro fertilization was really kind of starting to take off. I was a resident OBGYN between 1982 and 1986. The first IVF baby was born in 1978. So this was really the very early stages of IVF. We were fortunate that at my residency program, one of the guys that was a new attending had come from USC, which had the second IVF program in the country. So he had actually been trained to do it. And he set up an IVF program at the University of Chicago where I was a resident while I was there.
That's amazing. Like the timing was impeccable for you.
Timing was perfect. And then they gave us some elective time to go do outside rotations during that 4 years. And I chose to do one of them at USC.
Hmm.
And in that reproductive endocrinology and fertility department. So I got to know the people there, applied for a fellowship, and then ended up going there to do my fellowship. So, it was kind of a process that evolved over time as to what I wanted to do. But clearly, after 40 years, I know I made the right decision.
Yeah, I love that it all fell into place so naturally for you. It was like natural progression. It was meant to be for you to go into fertility. So I know so you said in 1992, this is in your bio, that you founded Orange County's first independent IVF center. What was the landscape like back then for reproductive medicine?
It
And
was it was pretty barren. I mean, in Orange County, there were only two programs: the UC Irvine program and the one that I was eventually working at when I came down here that was affiliated with Hoag Hospital. Back in those days, all the IVF programs were hospital based. There really hadn't been anything that was done
mm,
outside of a hospital situation.
mhm.
So I was really the first one to do that.
Yeah, so
And
what
now,
inspired you to take that leap? Like what motivated you to go, okay, I'm going to be independent and set up a private
Well,
practice?
working for hospitals, not an easy job. You've got a lot of layers of administrators overlooking what you do, making decisions about how you do things. And it was just, time for me to do my own thing. I had
Mhm.
some opportunities that presented themselves that allowed me to set this up. So it really was a natural progression. And really nowadays there aren't any hospital-based IVF programs. They're all independent and outside of hospitals. So that was really kind of the way it was going to go anyway. I just
Right.
decided to take it on at an early stage.
Yeah. So you were kind of one of the pioneers in Southern California to take the
In
lead.
that in that sense, yeah.
Mhm. Yeah, and I know you helped introduce the techniques like assisted hatching and blastocyst culturing to Southern California or to the region. What was it like being a pioneer for those techniques? I mean, they're
Well, in those days we didn't really think of it that way. You were just always trying to find ways of improving outcomes. So when I started doing IVF, the success rate of an embryo transfer was about 10 to 12%. It was really dismal.
wow.
So if anybody ever got pregnant, it was like a big deal. And then in,
Wow.
in 2000, I went to an international IVF meeting in Sydney, Australia. And at that meeting, I attended a couple of sessions with a couple of the pioneers of genetic testing in IVF who are now my friends. I didn't
Mhm.
know them at the time. And they were presenting data that showed that they had a way of doing chromosome testing on embryos. And in those days, it was very basic. They could only test, I think it was five chromosomes out of the 46 or out of the 23 pairs. And yet you could kind of see the writing on the wall. At least I could. I thought, boy, this is going to be the wave of the future. You're going to be able to do genetic testing on embryos. And once you do that, you're going to be able to greatly increase the success rate and efficiency of the whole process. And so when I came back from that meeting, I started thinking about what is it that we're going to need to do to be able to put that into place. The technology was the limiting factor. It was very early initial stages. They were using something called fish, which was something we don't even use anymore.
Mhm.
Uh, and actually, as that started to be used by centers around the world, the results were really very disappointing. And that was because you were biopsying embryos that were 3 days old. They had 8 cells at most. So you're taking one cell off and trying to make a diagnosis. And it just, and diagnosing it with only a handful of chromosomes. So there's no reason that really should have helped. And then the improvements that we started to realize that might make a difference were, first of all, being able to culture embryos past that 3 day stage.
Mhm.
So, and the initial guys that were doing that, one of them was from Australia also, and the other one was Barry Bear, who was in this country. And so he became our lab director. Actually, I sought him out because we wanted to learn how to do that, and so he came and helped us set up that blastocyst culturing program, and that allowed us to grow embryos to the point where they had hundreds of cells rather than 8. And that meant that we could do genetic testing by removing more cells, making it way more efficient and way more reliable and specific. And so all we needed to do was, grow the blastocyst, which we learned how to do. We had somebody who came in and learned how to do the embryo biopsy procedure, which again was something that had to be developed. And so all we needed was that technological break that allowed us to do the testing of all the chromosomes. And that happened in 2010. So by 2010, we now had all the tools in place because we had started working on those 10 years prior. And
Mhm.
all we had to do is just say, okay, we're going to do it. So we started doing that testing in 2011 on select patients. The pregnancy rates initially were in the 80% range. So obviously we're very excited, proved that it was
Yeah,
working. And by 2012, we were doing it on everybody. Done it that way ever since.
that's incredible. Because I remember when I started working with you, we were still doing day three fresh transfers.
Yeah, yeah,
You
and
know,
we did that for. I mean, because that's the way IVF was done. I mean, that's the best we could do back in those days. The other thing was the freezing method we were using then just wasn't very good. It was a
Mhm.
process called slow freezing. It was done in a machine actually that everybody had, and it just didn't work very well. So in 2008, a new type of freezing became available called vitrification, and that's what we use now. And that changed everything because once we had that, and then 2 years later, we had the genetic testing capabilities. We stopped doing fresh transfers altogether because vitrification was very, very good. You always got the embryos to, for the most part, to survive the freezing and thawing. And so once we had that, we realized we didn't need to do fresh transfers anymore. In order to get the genetic testing results back, it takes a couple of weeks. So you
Mhm.
can't keep embryos in culture for 2 weeks. They have to be frozen on the time that you biopsy them. So
Right.
all these things just kind of came together to get us to where we are now.
It's also amazing to me because having been in like supporting IVF with acupuncture for over 2 decades, I've kind of seen the progress, and I still remember how uncomfortable patients were when they were doing fresh transfers, especially if they had OHSS or PCOS or any type of those conditions. I mean, they just had such a hard time after
Yeah,
transfer.
that's for sure. And not only that, it really wasn't an optimal time to do the transfers. So when we were doing the stimulations, for instance, we would monitor levels of estrogen and also progesterone. And we learned that when the progesterone levels started to go up, and this was prior to the egg retrieval, that meant the clocking was ticking in terms of the receptivity of the uterine lining
Right.
developing. So once we saw the levels of progesterone go up, we had to give the trigger shot and take out the eggs, whether their follicles were ready or not. So
Okay.
back in those days, we had a lot more immature eggs. We had a lot lower
Mhm.
percentage of them that fertilized and became blastocysts that we could test. So that's one of the things that we really did do differently once we were freezing all the embryos. We didn't have to worry about the progesterone anymore because we're not putting the embryos in a few days later. That
Right.
allowed us to take the stimulation out a little bit longer, get more mature eggs, get more biopsiable embryos. And so it just all kind of really helped us to make the whole process more efficient.
Yeah, and not to mention just having patients feeling more comfortable through that whole process too.
Absolutely, yeah. I mean, it was a win-win. They felt better. We let them have time for them to recover. I mean, they could do the transfer months later. It didn't even have to be right away if they didn't want to.
Mhm.
So, I mean, all the way around, it was just a way better way to go.
Yeah, and I would even imagine like for endometriosis patients, if they had to do surgery, for example, before transfer, like that, it was an ideal method
Yeah,
of treatment for sure.
that's right.
So, so Dr. Anderson, you've been practicing for over 30 years, and I'm going to
Over
ask
40
you
years.
about what's that?
Over 40 years now.
No, really? You look too
Well,
young.
I started my fellowship 40 years ago. I 1986, I started my fellowship. So I've been in this field now for 40 years.
Oh, well, you look way too young. So, okay,
How
40
that
plus
happened,
years,
actually.
40 plus years in practice. And,
Yeah, it goes
you
by
know,
fast.
yeah, and as an acupuncturist that's been working with you for, almost 20 of it, of course I have to ask you about the incorporation of acupuncture. So what was the trajectory of the integration? And was there like a conference you went to, a paper you read, or was there something that made you go, acupuncture might be something that I want to look into to
It
integrate?
was far less scientific than that. It was mostly the patients started doing it.
Okay,
And
fair.
yeah, uh, they were asking for it. And believe it or not, back in those days, I was not well, maybe you do believe it. I wasn't a big supporter of acupuncture. I kind of didn't understand that it did anything. I mean, I heard the claims that some of the acupuncturists made about they were a little bit over the top. Every time there was a pregnancy, they said it was because of the acupuncture. And, they
Mhm.
made a lot of claims about things that I think even you wouldn't agree with. So I said, well, this is what the people want. Let's give them what they want. So we started doing acupuncture whenever patients asked for it. And early on in that, I thought, I better do this myself just to see what it's all about. So I had the acupuncturist do a treatment for me, and for about 4 hours after that, I felt like I'd taken a Xanax or something. I was just relaxed, and it was amazing. And I was sold. Once I did that, I said, "Oh, this really does do something. It's not just hocus pocus."
I love that.
And then there were studies that started coming out that showed
Mhm.
benefits, and I think the major benefits, probably from a physiologic standpoint, were that they showed by doing Doppler ultrasounds that they could increase the blood flow to the uterus and the ovaries. I think that's the main physiological benefit of acupuncture. And then obviously there's the relaxation
Mhm.
aspect of it that I experienced, and the kind of a stress management if they're doing it, a couple times a week. So I think that it's worked nicely. We have probably more people doing acupuncture now than ever. Certainly not a requirement, but we had some this morning on the embryo transfers I just did. So I think it's been a nice adjunct. I think it does have benefits, both physiological and otherwise, and so we're happy to incorporate that into our treatment regimen
Wow.
whenever it's necessary.
Well, we love that you're such an advocate for acupuncture. So we really appreciate that. And it seems, so I should probably ask you this. I don't even know if you know this, but what percentage of your patients actually incorporate acupuncture during an IVF cycle?
Uh, you're right. I don't know, but I'm going to guess it's probably about a third.
A third?
Yeah,
Yeah.
and
And has that gone up?
I might be underestimating it. I
Mhm.
think it's gone up. I mean, we don't really track it, but I'm sure that compared to when we first started doing it, it definitely probably more prevalent now than it was then.
Yeah. And can I ask you if you've seen any noticeable difference between the patients that incorporate acupuncture and the patients that don't
In terms of outcome,
in terms of outcome?
I don't think I could speak to that. We don't really keep statistics that way, so um,
Mhm.
yeah, it's just really hard to say if that's something that we can, show from a statistical standpoint.
Okay. And how long ago did you start incorporating acupuncture for, because I know that you recommend it on the day of transfer for patients to receive acupuncture 25 minutes before and 25 minutes after embryo transfer. How long ago did you start that protocol?
Well, you said you've been working with me for 20 years, so it might have been 25 years ago.
Okay, right on.
Yeah, yeah.
Awesome. So, is there anything else you would like to share, Dr. Anderson, as far as the future of IVF? And I know that you've done a lot of work in stem cell research and regenerative medicine. Just curious, is there anything that you see that's on the horizon?
Well, it's probably like most things in medicine that are going to be impactful in the years to come. It's probably going to be something related to genetics. Genetics seems to be an area where we know so much more now than we ever did, but there's still so much more for us to learn. For instance, the testing that we're talking about when we're testing chromosomes on the embryos is really all that we're able to test. Chromosomes are enormous pieces of DNA compared to genes. There's sometimes hundreds of genes, if not more, on a single chromosome. I think there's just research being done now that's going to probably identify other things that we can screen embryos for other than just chromosomes, which may allow us to be even more selective in terms
Mhm.
of which embryos to transfer, which ones are more likely to implant, and also because gene editing is starting to become a thing. It's been used now. This is Cat8, um, is something that probably down the line is going to be more and more applicable. We can technically do it in our lab right now. We can do gene editing. It's a very simple process, but you have to find the right situation to use it. And
Right.
right now, there's a couple of diseases where it's being used. It's not routine, but I just see that things like that and other types of genetic um, changes are probably going to be the thing that impacts IVF in the years to come. Hopefully for the better.
That's right. Well, so do you have any advice that you have for couples that are beginning their journey to parenthood or starting the IVF process?
Probably it's be patient and be persistent because
Yeah.
it is a process. It doesn't always happen the first time.
Right.
Sometimes we don't get normal embryos the first go around. Everybody has different numbers. Age comes into play, obviously, but there's just a lot of variables. So it can be an arduous process, but I see the patients of mine that are successful are the ones that just aren't willing to give up, and
Mhm.
they're persistent, and they realize it does take some time, and eventually most of them are going to get where they want to be. There's a lot of options that we have nowadays that we didn't when I started.
That's
Things like
right.
egg donation and surrogacy and
Mhm.
things like that. So we can typically find something that works for most people, but I just have to encourage them to stick with it.
Yeah, that's great advice. I call it the three Ps. Patience plus perseverance equals healthy pregnancy. And you
Yep,
just gotta stick to it. And
totally agree with that.
Mhm. Well, thank you so much, Dr. Anderson, for your time. I really appreciate it. And I'm really excited about what the future has to hold for fertility, for genetics. And yeah, I think at some point, I hope that you publish some papers on some of the work you've done with acupuncture, because I do think that you are one of the pioneers in Southern California for integrating acupuncture so seamlessly into your practice. So that's my hope.
All right, very good. Well, it's been a pleasure working with you all these years. Look forward to many more years of success and lots more babies.
Same here. Thank you, Dr. Anderson.
Take care.